Good day everyone, I'm Kristal Lemoncito, your student nurse for today for Davao Doctors College from BSN 11K Group 43. So today, I'm gonna demonstrate or perform the assessing the thorax and lungs. So thorax and lungs is an essential component of a complete examination. It is important to do the assessing of thorax and lungs because it is part of our respiratory system and it is necessary to assess the thorax and lungs. So, before we proceed to the assessing thorax, we need to check first the history of the client and also prepare for the proper equipment to use. And after checking and preparing, we need to perform hand washing for the proper hygiene, and after that, we go to the client. Hello ma'am, ako din si Kristal, ang inyong student nurse karong adlaw. So ma'am, pwede ko mautan ang sulong pangalan? How about sa mga edad ma'am? So ma'am, saan pwede na ko itawag sa inyong comfortable ka na itawag ako sa ma'am throughout sa itong assessing na buhaton karon. Okay ma'am Queen. Okay ma'am Queen, so naama kay mga medical history ma'am? Or na ba kay mga shortness of breath na na-experience dati? Okay, ma'am. So, karon ma'am, mag-conduct assessment about sa thorax and lungs para ma-check ma'am if wala ba kay mga abnormalities or okay ra ba yung lungs or thorax ma'am. So, before we start ma'am, okay ra ba sa mo ang kabugnaw sa aircon? Wala ba kay gitugnaw o giigang? Ma'am. Check for the signs or respiratory distress or problem with oxygenation. So in this step, we need to observe the client's lips, color of the face, patient's chest, and fingernails of any cyanosis. Palpate super external notch and noted the position of the trachea. So since I don't have a real patient, I am going to perform it by myself. So to pop is fraternal notch. Place your hand in a super external notch and you need to know the position of the trachea and it should be in the midline. So it will be like this. When the client stands with the arms and the sides stood behind the client and observed of the position of scapulae and the shape of the comparison of the chest wall. From a lateral position, observe the three normal curvatures, cervical, thoracic, and lumbar. To assess for lateral duration of spine or scoliosis, observe the standing client from the rear, have the client bend forward halfway and observe from behind. Assess the temperature and the integrity of all chest scales. Palpate all thorax areas for bulges, tenderness, and abnormal movements. So in these procedures, I am going to ask the patient to cross his hands and put his hands to opposite shoulders like this. And I'm going to ask the patient to breathe normally, and we're going to palpate the chest wall. So ma'am, tell me if it hurts, ma'am. So this is to assess any lesions or any abnormalities. Place the palms of both of your hands over the lower thorax with your thumbs adjacent to spine and your fingers stretched laterally. Ask the client to take a deep breath when observe the movement of your hands and any leg of movements. So ma'am, inhale and exhale and breathe normally. So we're going to place our hands to feel the lower thorax and feel for the range and symmetry of the movement. So place the palmar surface of your fingertips or the ulnar aspects of your hand and close fist on the posterior thorax starting near the apex lungs. Ask the client to repeat such words like the blue moon or 1, 2, 3. Repeat the state moving hand sequentially to the base of the lungs. You will start toward to the midlines at the level of the left scapula and move your hand left to right, comparing findings bilaterally. Compare the fermenters on both lungs and between the apex and the base of each lungs using either corresponding area or using either one hand and moving it from one side of the client to the corresponding area on the other side, or using two hands that place simultaneously on the corresponding area of each side of the thorax. So, ma'am, I'm going to put my hands on your chest, ma'am, and please say blue moon every time I touch you. So in this part, we're going to place our hands or both of our hands and feel for the vibration as the patient continues saying it's blue moon. So continue the procedure by percusting the chest in a systematic manner, moving down to the thorax from side to side as demonstrated in a latter pattern. We will listen for the vibration, intensity, and duration of. You will also locate areas where you hear abnormal dullness. In this procedure, we will be tapping the patient. So place the diaphragm of the stethoscope firmly and directly on the posterior chest wall. At the apex of lungs at C7, ask the client to breathe deeply through the mouth for each area of auscultation using the systematic ladder pattern used in partition. Listen at each point to the breath sound during the complete inspiration and expiration. Compare the findings at each point with the corresponding point on the opposite side of the thorax. To do this, we will place the diaphragm on the chest like this. So, we will be listen to the duration of breathing sound and rate it. So ma'am, take a deep breath with your mouth wide open, please. Brown Company asked the client to repeat the phrase 99 while auscultating the chest wall. Egophony asks the client to repeat letter E while listening over the chest wall. Pectoral locking asks the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. So ma'am, can you please say 99, ma'am? Next, ma'am, say E. Next, ma'am, you will whisper 1, 2, 3. 1, 2, 3. So in this procedure, we will be examining the anterior thorax of the patient. So have the patient lay in a supine position and breathe normally. So ma'am, we will be examining the anterior thorax. So just breathe normally, ma'am. So, we will be assessing respiratory exertion, so you will place your thumbs along each costal margin with your hands along with lateral rib cage. So you will also ask the patient or client to take a deep breath. By this, you will feel the range and symmetry of the movement as the patient exhales. Okay, Ma'am Queen, just take a deep breath. So, in palpating tactical feminist, you will compare symmetrical areas while the patient says 99. So, in this step, you will place your hand in these areas and ask the patient to say 99. So, ma'am, can you say 99, ma'am? Place the diagram of the stethoscope firmly and directly on the anterior chest while asking the client to breathe deeply through the mouth in an effort to avoid transmission of sound that may occur while nasal breathing. Listen at each side for at least complete respiratory cycle. So, ma'am, can you please say 99 again, ma'am? Next, summarize the information obtained during the working phase and discuss the findings to the client. Provide the client the opportunity to clarify and ask or raise any concern. So, ma'am, I'm going to sum up all the reviews and came up that your lungs and thorax are all normal. There's no dullness or abnormalities found. So, ma'am, do you have any questions or clarifications about our assessment? Okay, ma'am. So, ma'am, once again, thank you for participation in our assessment. After you thank the client, you will do the proper hand hygiene.